Good afternoon. I'm Michelle Comp. I'm your stroke and chest pain coordinator at Thomasville Medical Center, and I'd like to review the PI projects that Thomasville is currently working on for our stroke patients. Our first PI is dysphagia screen compliance. The issue that was identified here was that providers were able to place an MPO order and a diet order for patients that were being admitted for stroke evaluation. It was identified that the MPO order was actually a nurse in communication and the patient was still receiving a diet. Our goal was to reduce aspiration risk for code stroke patients, and some actions that were taken were we evaluated the stroke order set utilization, we implemented nurse provider communication process for diet orders after a past screen, and we recommended automatic speech consults for failed patients with dysphagia screens. So in 2024, we were at 78%, and for 2025, we were at 93%. So there's a significant improvement over the last year as far as dysphagia screen compliance. The next PI is door-to-CT image initiation for our POV patients. Those are our patients that arrive to the ED via their private vehicle. The issue identified was a lack of defined roles in our code stroke process. So our goal was to decrease the door-to-CT imaging initiation to be within 20 minutes of arrival. So some actions that were taken were we implemented a radiology delay log where they were able to identify any areas that might not be documented in the chart to help us pinpoint where there might be some breakdown in the code stroke process. We also did BFAST education to registration staff, and we updated the ED code stroke process for clear role assignments. Our outcomes from January to April of 2025, we met this goal 38% of the time, and from May to December, we met the goal 56% of the time. This is a 21% improvement from the beginning of 2025 to the end of 2025. Our next project was decreased thrombolytic order to administration time. The issue identified was inconsistent code stroke workflow and limited staff confidence with TNK preparation. Our goal was to reduce the order to administration time to less than 10 minutes. A couple of actions that were taken were we clarified the ED code stroke roles and responsibilities. We conducted hands-on TNK reconstitution education, and the stroke coordinator started observing more closely the code stroke process and implemented a post code stroke and TNK administration event debriefing. Our outcomes with 2024, we had a median time of 13 minutes, and for 2025, we had a median time of 12 minutes. However, we implemented this PI in April, and from May to December, we actually decreased it by 11 minutes from the start in April to where we ended in December. So really good job with this PI and the team that has been working really hard with this. Additionally, we wanted to decrease our door in, door out time for patients that have an LVO and are thrombectomy eligible, for our hemorrhagic and post-thrombolytic stroke patients. An issue that was identified was bed availability at the tertiary facility and transportation delays. So our goal was to reduce the door in, door out time, and a couple of actions that were taken were we developed the ED to tertiary transfer process. We improved the code stroke process with role clarity for transfers. We collaborated with Central Bed Management and Novant Health AirLink, and we clarified provider communication and transport prioritization. So some outcomes for our LVO and MER eligible, we went from 155 minutes to 137 minutes. That's a decrease in 18 minutes. Our hemorrhagic stroke patients, we went from 297 to 270, a decrease in 27 minutes. And for our post-thrombolytic, we went from 590 to 330, which is a decrease in 256 minutes. So there's more room to come, more opportunity for improvement here. However, we already see significant improvement with this PI. The last project I'd like to review today is our project to increase stroke patient perception of care survey volume. Issues identified were patient identification, guest services communication, and coverage gaps. Our goal was to increase survey completion to improve stroke patient experience and eventually their outcomes. Actions taken were implementing new survey collection, establishing daily communication to identify stroke admissions, educating and partnering with guest services. Our outcomes in 2024, we had a 14% survey response rate. And as of December, our rate was 46%, so a significant improvement over the last year with our patient perception of care surveys. This concludes our PI project review. If you have any questions, please don't hesitate to reach out to me. I've provided my email address and my office number at the bottom there, and I look forward to hearing from everybody. Thank you.